So now let's start with the various forms of cell death. So the first form will be the necrosis. So necrosis is the most common form we all must have read, and it is always pathological. Okay, necrosis is never physiological, it is always associated with some pathological condition, and necrosis is always associated with membrane damage. So now just now we saw there is going to be membrane damage in irreversible cell death, right? So whenever there is membrane damage, calcium influx will happen, which will lead to enzyme activation, and enzyme activation, endonuclease is activated, which will result in nuclear features of the necrosis, right? So whenever membrane is damaged, also the cellular contents are going to be extruded into the extracellular environment. So when this kind of leakage into the environment is there, it is going to recruit various leukocytes. So leukocytic recruitment will be there, which will result in inflammation. So these two are the classical things which we see with necrosis. Membrane damage always associated with inflammation. So along with that, there is cellular swelling. So cellular swelling, I already told in reversible cell injury how this NAK ATPase pump was inactivated, right? So loss of failure of this NAK ATPase pump led to cellular swelling. So that can in turn lead to necrosis kind of cell death. So morphologically, the cell is going to be swollen up in necrosis, and the classical nuclear features, which is nuclear pycnosis, karyorexis and karyolysis. So these four features are the classical features we see in necrosis. Starting with the cell swelling, then the nuclear changes, which is pycnosis, karyorexis and karyolysis. Then there will be membrane damage. So associated inflammation is going to be present. So what are the various forms or patterns of necrosis? So we'll start with coagulative necrosis first. So coagulative necrosis is the most common type of necrosis, and here it is going to result from the denaturation of the cellular proteins. So when the cellular proteins denaturate, it can result in coagulative necrosis. So what is the most common cause of this coagulative necrosis? It is going to be ischemia. So whenever ischemia is there, that is loss of blood supply, it is going to produce an infarct in the area. So loss of blood supply, that area which the blood vessel is supplying is going to undergo infarction. So that is called as an infarct, and these infarcts are classically seen in the solid organs. So solid organs like heart, kidney and liver will undergo coagulative necrosis in response to ischemia. There is another solid organ, which is the brain. So in brain, whenever there is ischemia, it is not going to lead to coagulative necrosis, but it is going to lead to liquefactive necrosis. So this is very, very important. So everywhere ischemia is going to lead to coagulative necrosis, except in brain, where it is going to lead to liquefactive necrosis. So infarcts are of two types, white infarct and red infarct. So white infarct is going to be present in solid organs. So whenever there is an end or arterial supply, so if that vessel is going to be occluded, there is no other blood vessel to compensate for this ischemia. So what happens, that part of the organ which is supplied by this vessel is going to undergo infarct, which is going to appear white because there is no other blood supply. So examples of this white infarct is going to be present in heart and kidney. So it usually happens in solid organs with end organ blood supply. So red infarct are the ones which appear red in color. Rather than being white, it is going to appear red in color because it is going to appear, these kind of infarcts appear in loose connective tissue. So whenever the tissue is loose, the blood can still seep into the tissue. So that way the blood is going to be present. So it is going to give a red color. So red infarcts are seen in loose connective tissue, and again it is going to seen in organs which have dual blood supply. So again one artery is being blocked over here, but some other artery is still able to supply to that area. So it is still going to be present, it is still going to be preserved. So that is going to be red in color. So this kind of red infarcts are seen in organs with dual blood supply like liver and lung. So in liver we have both portal vein and hepatic artery. So in lung also we have bronchial artery and pulmonary artery. So dual blood supply is present, it will lead to red infarct. Let's see the image of this coagulative necrosis. So this is a organ in which, this is solid organ in which you are seeing this kind of tan white infarct, which is having this wedge shaped structure. So the origin of the infarct, the blood vessel is going to be occluded at the tip of the apex or the apex, and the base which is going to be formed by the base of the organ. So the base of the infarct is formed by the base of the organ. So wedge shaped infarcts are seen in solid organs due to coagulative necrosis. And microscopically, if you see, there is going to be preservation of the tissue architecture in coagulative necrosis. So if you see, this is a kidney. So this is the glomerulus and these are all the tubules, but they don't look normal like, right? They are looking kind of pale and pink, and they don't have the nucleus. So nucleus is not there in most of the tissue here, so because the nucleus has been lost by coagulative necrosis. So it gives the appearance of some ghost, right? So ghost tissue, ghost appearance, or tombstone appearance we call it as. So tombstone appearance or ghost appearance is due to the preservation of tissue architecture in coagulative necrosis. So where else do you get this tombstone appearance? Yes, it is seen in another skin condition called as pemphigus vulgaris. So pemphigus vulgaris is a skin condition in which you are going to have autoantibodies directed against the desmosomes. So when autoantibodies are formed, it is going to cause a cleft or split between the basal layer and other layers of the stratified squamous epithelium. So the suprabasal cleft is called, seen in pemphigus vulgaris. So when this split is there and the basal layers are still lining this cleft, so it appears as if there are the cells are arranged like a tombstone. So there again tombstone appearance is there. So tombstone appearance is present both in pemphigus vulgaris and also in coagulative necrosis. There is a special kind of necrosis called as Zenker's degeneration. It is a type of coagulative necrosis only, which is seen in conditions like typhoid fever. So in typhoid fever, we have some waxy hyaline appearance of this Zenker's degeneration, especially in skeletal muscles like rectus abdominis and also in the diaphragm. So Zenker's degeneration is a type of coagulative necrosis seen in typhoid fever in the skeletal muscles like diaphragm and rectus abdominis. Next type of necrosis will be a liquefactive necrosis. So as the name suggests, it is going to be liquid-like. That is why it is given the name liquefactive. It is also called as colliquative necrosis. And here the cause of this necrosis is due to lysosomal hydrolytic enzymes. So there are going to be enzymes which are present. So these lysosomal hydrolytic enzymes are going to cause liquefaction. So the entire tissue is going to become like a liquid. So these organs which are rich in hydrolytic enzymes are going to undergo liquefactive necrosis. So that is the reason why brain and pancreatic tissue, even during ischemia, they undergo liquefactive necrosis. So because both brain and pancreas are rich in this hydrolytic enzymes. So ischemia in brain and pancreas will result in liquefactive necrosis rather than coagulative necrosis. And the most common cause of this liquefactive necrosis is actually bacterial infection. So any infection you see, what happens is the tissue architecture is not preserved over there. You see lots of inflammatory cells and the entire tissue has become a liquid-like state. So that is because most common cause is bacterial infection. So this first image is that exact image in Robbins also. So this is a liquefactive necrosis and this is the brain structure. You see this sulci and gyre, right? So in the brain you are seeing a liquefactive necrosis. This picture based image has also been asked before. And the second image is the microscopic image of this liquefactive necrosis. So here you see lots of these inflammatory neutrophils, right? And the central part is all the necrotic part, and you cannot identify what is the parent tissue. The cell's morphology is all lost. That is, the tissue architecture is not preserved in liquefactive necrosis. The third type of necrosis is caseous necrosis. Caseous literally means it is cheese-like. So it is going to appear like cheese. On gross, if you see, the specimen will have some cheesy material which is characteristic of tuberculosis in our country. Other than that, there is other causes of caseous necrosis like histoplasmosis and coccidioides also. So coccidioidomycosis and histoplasmosis also can result in caseous necrosis, but most commonly in India it is going to be tuberculous cause. Whenever you see caseous necrosis, unless you rule out tuberculosis, you don't proceed on with other causes. Okay. So this caseous necrosis is also a combination of both coagulative and liquefactive necrosis, but more of coagulative necrosis than liquefactive necrosis. Okay. So grossly if you see, this is a lung tissue. In this you are seeing this cheesy kind of material which is the caseous necrosis due to tuberculosis in this. So microscopically, tuberculosis, caseous necrosis, you always see a granuloma, right? So classical feature is epithelioid cell granulomas. So the center part is the caseous necrosis which is appearing quite granular. So the granular appearance of this caseous necrosis can be seen. It doesn't look like liquefactive necrosis, it doesn't look like coagulative necrosis. Okay, so it looks quite granular, and this is called as caseous necrosis on microscopy. And surrounding that, you see the epithelioid macrophages. So epithelioid macrophages are nothing but modified macrophages which have a slipper shaped nucleus. So the nucleus is going to appear slipper shaped because their function is going to be secretory function. They secrete lots of cytokines and interleukins. So secretory function is going to be there for this epithelioid macrophages. These are nothing but modified macrophages which we see in these granulomas. Then surrounding that, you have a collar of these lymphocytes, which are these small dark blue colored cells. So lymphocytes are there. Apart from that, you see these kind of giant cells called as Langerhans giant cells. So remember, it is not Langerhans giant cell. Langerhans cells are different cells. These are Langerhans cells are dendritic cells which we see in skin. So these are Langerhans giant cells seen in tuberculosis. So they have a peripheral horseshoe shaped arrangement of the nuclei. Okay. So now we are seen about caseous necrosis. Let's see about fat necrosis. So fat necrosis is going to be seen in tissues where fat is going to be present. So where do you see fat? Breast tissue, then omental tissue. So in breast, due to any trauma, so whenever there is a trauma, there is going to be fat necrosis. In omentum, it is going to be seen in acute pancreatitis. So what happens in acute pancreatitis is that there is going to be inappropriate activation of the pancreatic enzymes. So auto activation of the trypsin enzyme will be present, and this trypsin will in turn activate the other enzymes. So other enzymes like lipases and proteases will also be elastases will also be activated. So lipases will be activated. So this is going to break down the fat into fatty acids. So these fatty acids are going to be produced, and this fat will undergo necrosis. So this kind of necrosis which we see in this acute pancreatitis is going to be fat necrosis. And grossly, what happens is this fatty acid is going to accumulate calcium. So it is going to attract calcium, and there will be saponification of this fat. So this together is going to result in the saponification of the fat. So grossly, if you see, this is the fat tissue which is appearing yellow, and in that you are seeing these kind of small white dots, right? So these are looking like chalky white deposits. So this represents the fat necrosis. So microscopically, if you see, this is the this left part is going to be the normal fat tissue, and the right part, you can see that the adipose tissue had all lost its shape, and it is all appearing loose like this halfway through, and there is some kind of violet or basophilic material in that, which is going to be calcium. Okay, so this is the right side image is the one which is representing the fat necrosis here. Then the next type of necrosis will be fibrinoid necrosis. So fibrinoid, as the name suggests, there is something related to fibrin. So fibrin plus something is going to be present in fibrinoid necrosis. So what is that something? It is going to be antigen antibody immune complexes. So whenever there is an endothelial injury, what will happen? There will be coagulation cascade activation, which will result in the formation of the fibrin. So fibrin along with this immune complex is going to be deposited around the vessel wall commonly, and that is going to result in the fibrinoid necrosis. This is what we call it as fibrinoid necrosis. It is classically seen in type 3 hypersensitivity reaction. So what are the examples? So the same examples of type 3 hypersensitivity reaction we can give it here also. So systemic lupus erythematosus, polyarthritis nodosa, malignant hypertension. So all of this is associated with fibrinoid necrosis. So this is a classical image on microscopy. So the center part is the vessel actually, which is filled with the RBCs. So surrounding that, on the vessel wall, you see all of this pink material, right? So this is the fibrin which has deposited along with the antigen antibody complex, which is the immune complex. So the last type of necrosis will be gangrene. So gangrene is usually a clinical term which we use. So gangrene can either be a dry gangrene or a wet gangrene. So whenever there is going to be ischemia or loss of blood supply, it will result in a dry gangrene like this. So commonly we see this kind of thing in a smoker, right? So this kind of ischemia will result in a dry gangrene. So dry gangrene will result in coagulative necrosis because there is ischemia. However, on this, if there is superadded bacterial infection, so what will happen when there is bacterial infection? So in bacterial infection was the most common cause of liquefactive necrosis. So it will form a wet gangrene in which we see liquefactive necrosis. So it is all having this pus material around on the gangrene. So this is a wet gangrene which has liquefactive necrosis.